everyone. Welcome to the drill, or what we like to call, this is not a drill. So, as you all know, we are currently in a public health pandemic. So, we are, as Black Lives Matter, we are trying to transition over to the internet. The way that we're trying to move forward is basically moving all our campaigns online in the interest of all of our organizers and in the interest of the community. So we're going to be getting started really soon as people start trickling in. My name is Megan Castillo, and I am a Black Lives Matter activist. If we are hoping that you send your questions via the question box down below. And we're going to be getting started. We have a long list of panelists. I'm going to be reading from my notes. So on our list, we have Dr. Emily Bargoma, who's a molecular biologist. We have Dr. Brandie Cross, who is a biochemist. We have Timon Durrett, who's an actor and emergency preparedness advocate. We have Akili, who is a veteran organizer. Billy and Godson, who is a Black community safety provider. We have Marcia Riley, who is a gig economy worker. And Dr. Anthony Radcliffe, who is a professor. So while we wait for more folks to trickle in, we want you to grab some water, grab some notes, and we are hoping to basically share critical information and lessen the risk and increase preparedness for Black Los Angeles. This is our efforts to maintain mutual aid, and we hope that you are ready. Brandie, if you are here, we are going to bring you on.
Hello.
Hi there. How are you?
Hola, bonjour.
Bonjour, bonjour. Thank you for joining us.
Hi. So I'm Dr. Brandie Cross. I'm known as the Pot Lab PhD because usually I'm talking about cannabis. But today we're talking about COVID-19 and the Black community. And so I'll be adding a few little herbal remedies if you're not feeling well at the end. But I'm going to quickly go through the Leimert Park COVID-19 zine that we made. It's on our website at leimertpark.org. And you can get that and download it free, print it free, and hand it out in your community. So I just wanted to touch on stuff that we can actually do to, mitigate this crisis. And I wanted to touch on, some of the rumors, everyone has these theories, and I just know that they're wrong. So I did my PhD at Johns Hopkins Medicine. I've worked with attenuated and live viruses before, and what I can say is this does not seem to be an engineered virus. Most of the viruses we work with in a lab or engineered viruses do have drug tags to easily kill them off when we're done. So when you hear these rumors, really talk to someone who's worked with a virus or worked in a biological containment. And then we'll tell you, we're like, those viruses are really weak. In fact, they're annoyingly weak. And sometimes we can't get our work done. Very unlikely that it's engineered. With that said, it is an animal virus that is mutated because of climate change and industrialized food and jumped into our bodies. So now what do we do? Well, this novel coronavirus is very contagious from mucus and like spit. And if you've ever talked to someone in the sunshine, you know that when you talk, sometimes you get a little spit coming out of your mouth.
Yeah.
And normally we're like, yeah. But right now we have to be really serious about that kind of thing. We call it, I forget what people call it, but when you talk, spit comes out of your mouth. And that's sometimes why people wear masks. Especially in Asian countries when they're walking around talking to people. So that's a really easy thing to do, but we don't want to buy all the masks in the world,
Right.
Only one, and they make reusable masks that you don't have to throw away. And the other thing is, and a lot of the grocery stores are now doing it, gloves. If you're touching public things, perhaps put on a glove. A glove. You only need one sometimes. So open a door, grab your things from the grocery store.
Right.
Then you're going to just roll it off, pull it over, throw it away. The other good thing to do is to wash your hands, of course, and not touch your face. This is because your hands can transfer the virus from surfaces to your face, and in your face are mucous membranes, where you snot from. And those get really irritated and can get infected. Those are the places you can get infected. So if you wear glasses, you're a little bit more protected. And a lot of people don't realize you can catch it through your eyes. Now, it's unlikely because there's far less mucous membranes in your eyes than your nose and your mouth. And that's the reason people wear masks. People who are immune compromised now, I would suggest that you always wear a mask when going into a public place or even outside if you're going to be in close proximity to people.
Yeah.
Now, for the rest of us, the Lysol wipes are sold out.
Yeah.
People ran and took all the things, but you can do this at home. One of the rumors that went around was that rum was good. Well, 151 rum will sanitize something, and Everclear will sanitize something.
Mm-hmm.
However, you can use 10% bleach if it's like a plastic package or something like that. Just very little bleach, a lot of water, and it will. That's what we use in a laboratory to kill all those engineers when we do experiments.
Right.
Also, OxiClean. OxiClean is great. It's because you have a phospholipid bilayer. They keep telling you to wash your hands because soap will, break that down. OxiClean bleach also will break that down. So if you have OxiClean in your house, you're good. A lot of people are panicking because they don't know how to sanitize. 60 to 75% alcohol, so rubbing alcohol can be diluted a little bit, or and you can look this up on the internet. You get little calculators of how you make these solutions.
Right.
What else? Oh, you can quarantine too. So if you're buying a lot of dry goods at the store right now, leave them in your car a few days. The sun will radiate them and it will break them down. Coronavirus, keep in mind, isn't like hepatitis where it has this huge protein coat that's super protected. Actually, the common cold derives from this virus, and that's why it's easy to kill. It has this, it's kind of like a bacteria, but not with living guts inside, basically. That's what all viruses are. They need to go in a cell to infect. But this virus in particular isn't going to be super resistant to cleaning products, is all I'm trying to get at. Right. You got Comet at home, you're good. You can dilute these things and clean things off. Now, you might not want to clean everything with bleach because you don't want everything to turn white, and that's fine. Alcohol and OxiClean are great for that. Now, if you are sick and you have a high fever, you're not all congested, you probably won't have a runny nose. You'll have some kind of symptoms like a fever and mostly a dry cough is what's noted with this. It's a COVID pneumonia, When you get to the point of feeling that way, what we're telling people is to call a doctor or see an online doctor. Don't wander into the hospital. Don't go spreading it farther, please. Because wherever you go, you're transferring this virus. So if you are infected, you have to think of yourself as like a time bomb. And not just really like a time bomb, but you have little viruses circulating all around as you walk through everything. And as you walk through things might fall off. Viruses or little spittles. And, you can't help it. And it's not your fault. I want people to understand it's not their fault. But we can prevent this by isolating ourselves. So if you're sick, use a tissue, wash your hands, and all that good stuff. And seek medical attention, please. If you have difficulty breathing, shortness of breath, those are the two times you need to call 911. This is when a ventilator. This is when you're going to need some immediate medical attention. Now, you're going to have to decide between shortness of breath and breathing difficulties, but in our basically say that's when that's when it's serious, because it can lead to a serious pneumonia, kidney failure, and death. Now, a lot of us are having a problem with isolating, and it's really easy. I'm saying this as someone who stays home a lot. Everything you do outside can be done inside, and you can go outside as long as you're not within 6 feet of other people. I mean, gardening, well, it's not sunny today, but tomorrow it's going to be sunny. And a lot of people are like, I'm going to go garden. Do healthy things. You don't have to sit and read a book and watch movies. It doesn't have to be a rain day. It can be a self-isolated backyard. You can go outside. You don't have to stay inside necessarily. The thing is, back inside, you want to leave your shoes at the door. You want to wash your hands, wipe down the doorknobs. You want to make sure that you didn't track anything in from outside. Relax. The military isn't going to come knock on your door. We don't have any reason to be so anxious. I know there's a lot of people anxious. Exercise is really important. Again, just like relaxing and exercise, they boost your immune system. They make you feel happy. Also, making bad jokes. We have a lot of bad jokes. I saw on Twitter somebody said, if you're working at home with your loved one, which I am, you can create an imaginary helper, an imaginary employee to blame everything on.
I did see that.
Or you can blame the cats or the dogs. You know, have a sense of humor, because this is really stressful for everyone. And the more we take it serious but keep our lives light, the happier we'll be, and the more resistant we'll be to being infected, period.
Right.
So I have in our zine, I said, get some sunshine. You can even sit in a window if you need to, but sunshine is really healthy for you, and it does help your immune system because we have to convert our vitamin D. And let's see. What else do I want to cover? Oh, deep cleaning is great. Great time to deep clean your house. It's spring.
Right.
It's a great time to garden. It's a great time to deep clean that house. And if you have all those disinfecting wipes that you're hoarding, maybe use them for that.
Well, listen, thank you so much, Dr. Cross. We've got a few questions down from our audience members. So, if you do not have access to masks, is it okay to wear a handkerchief over your mouth?
Technically, no. But we're talking about walking around, the city or, going outside. That is not going to really prevent it, but it's something. It's still a barrier. So at this point, most people don't have access to surgical masks that are going to actually prevent virus from coming in.
Yeah.
It's just a physical barrier. So I don't want to downplay it because just a physical barrier. You need a physical barrier. It makes it less likely to get infected. I want to be clear about that. Right. It doesn't have, it's a pore size. Viruses can make it through, but they have to be forced through. So the physical barrier is good regardless of what it is. And I think that people are on the internet now making them out of rubber bands and paper towels. Loop them, it can be done. So it's a good physical barrier, but it's that, is not going to 100%, keep you safe.
Right. We've got one more question about social distancing, or what folks are calling physical distancing. What about single parents, and what about parents with small children? How can they practice social distancing?
So when you're social distancing is just staying away from other people. So a lot of single parents, what they're doing is homeschooling, obviously, because a lot of the schools are closed, and providing activities. There's been a lot of great online activities listed, but when you're with your kids, you may get it from your kids, and your kids may not even be sick. Or I have a friend whose child was sick with COVID-19, actually got sick from it, and she's now sick with COVID-19. Now, in that case, you guys all got to self-isolate together anyways, so you're going to turn that into a quarantine.
Gotcha.
You have young kids in the house in a multi-generational family, which I didn't really get to, and I know it's something with Black and Latino families. We have our parents at our house. It's a financial thing. What you're going to want to do is keep grandma or grandpa, the grandpappies, separate from the rest of the house, and practice, actually in our zine, practice those hygiene requirements when going to see them, and probably using some kind of barrier to cover your mouth. We see people visiting their in-laws and stuff in through a window even. So contagious, and you really want to keep those young kids, the young kids with no symptoms, away from the parents for at least 10 days and just see what happens. It's a week. I miss my mom too. I've been self-isolating for almost 3 weeks now. But it's so important to their longevity, especially those elders that have hypertension, diabetes, and everything else that's so prevalent in this, in our community. So
awesome. Well, thank you so much, Dr. Cross. Please do continue to engage on this town hall, as there are multiple questions coming in through the comments, but unfortunately we are out of time. So we're going to move on to our next guest, but thank you so much for joining in. Such a wealth of knowledge. So we want to check in and see if Dr. Radcliffe is still in or if Baba Keely is on to join us. And if they are not, then we are going to close out our session. But in the meantime, please do stay tapped in. A few things that you can do to get involved with Black Lives Matter Los Angeles and to continue on with mutual aid is one, text 5 friends to invite them to participate in BLMLAs. This is not a drill that's happening right now, so tell them to try to find the live that I've posted because it's going to stay up for at least another 24 hours. Also, tell them to call in to check in on elders and physically challenged family and friends and neighbors. We also want you to share BLMLA social media handles with your followers and friends so that they can stay plugged in to our work, and be sure to go to our website at blmla.org and get tapped in there so that you can sign up for our newsletter. But we appreciate all of you, and also feel free to donate to your Black-led grassroots organizations. Shameless plug, donate to us at gofundme.com/BLMLA. And please do stay tapped in. We appreciate all of you for tuning in. During these times, we definitely had to lean on each other. So appreciate you all. All right. That's it for today. Enjoy.